Marijuana is considered a controlled substance in the United States, and the federal government has the right to regulate and criminalize cannabis. However, multiple states have enacted effective decriminalization and medical laws throughout the United States. The question for the United States lies in the decision of whether or not marijuana should be completely outlawed, be fully legal, be legal for recreational purposes, or be legal for strictly medicinal purposes.
Marijuana is falsely portrayed in pop culture as only a substance of abuse and as a potentially dangerous narcotic.
Brass tacks.
Yes.
Just got a shipment of the dopest dope I've ever smoked. Hands down, dopest dope I've ever smoked, right?
Say, man, you got a joint?
No, not on me, man.
It'd be a lot cooler if you did.
Marijuana is currently viewed as an illegal recreational drug. Although it has a similar risk factor as alcohol, it remains illegal under federal law. While a proposed bill in California may give full legalization to marijuana, the focus should be on working towards full federal legalization for medicinal purposes.
It's an issue of doctors prescribing medical marijuana as a treatment for glaucoma or as a cancer treatment. I think that should be appropriate because there really is no difference between that and a doctor prescribing morphine or anything else.
Have you ever been against suggesting medical marijuana?
In my earlier years as a physician, I didn't understand the benefits so much, and now as more research is available, I've been more open to the use of medical marijuana. So the answer is yes. When I was a younger physician, I thought that it was more of a drug of abuse, and now I realize that there are some marvelous benefits to medical marijuana.
What benefits does medical marijuana give to your patients?
I have a limited amount of patients that I can answer to that. However, in general, I think science has shown that medical marijuana can benefit a number of patient problems or diseases. In particular, cancer therapy and treatment for nausea and weight loss, both in cancer patients and those that might suffer from AIDS, the AIDS wasting syndrome. It's been well proven to be very effective. There are many other conditions that it has been shown also to be effective in, such as glaucoma. Off the top of my head, I should probably think multiple sclerosis has some benefit. The treatment of cancer, chronic pain, and wasting with cancer. When we've exhausted all of the resources that we have available, I'll suggest it. I've also suggested it in another fellow who was devastated by the loss of his wife, who committed suicide and was losing a lot of weight. And we tried antidepressants and all sorts of other medications. And he came to me with the question about medical marijuana, could it be effective? So I didn't offer it to him as a treatment, though I agreed with him when he suggested that it might be an option, that he should try it, and he has had tremendous benefit from it. It has to be weighed against the abuse potential, but for medical uses, I think it's helpful. I would like to see it easier for me to prescribe medical marijuana to the patients that I think might need it. Though currently I don't prescribe it because that would, if I would, it might be possible that my Federal Food and Drug Administration license, known as a DEA, could be revoked. That's the federal license that allows me to prescribe very strong pain medicines like morphine or Demerol, and that's a part of my practice that I don't want to lose. So I refer it to others. The answer is yes. I wish I had the ability to prescribe it, but I myself don't because I'm worried about the federal regulations. California does allow it, though it could jeopardize a physician's ability to prescribe the federally controlled drugs.
Natural and fine,
Were you prescribed medical marijuana?
Cancer.
Okay, what type of cancer?
Adrenocortical cancer.
Did you have an objection to the suggestion of being prescribed medical marijuana?
At first I did, until I figured it would probably help me out in the long run because I was having a hard time eating and keeping food down. It made me hungry because I wasn't hungry. I was losing weight pretty rapidly.
Do you feel that California or the United States should push for the legalization of marijuana for medicinal purposes?
Definitely. I think there's people that are worse than I am that probably really need it.
While the legalization of marijuana is a highly debatable topic, we feel that there is one common ground that the country can stand on. That is, marijuana has shown to be an incredibly beneficial medical aid for many Americans that are suffering from physical and psychological conditions. It is for this reason that America should push for the federal legalization of medical marijuana.
But if the sun shine on, it's because of you.